Interstitial cystitis, or IC, is a chronic bladder condition that affects over 3 million women in the United States. Some studies estimate that the number could be closer to 8 million, but IC can go undiagnosed for years. Women will have different symptoms with the condition, but the most common symptoms are urinary frequency, urinary urgency, and pain. Many women report pain with a full bladder and can also experience pain with sex. As a chronic condition, there can be periods of remission where the symptoms are well controlled, and then times where symptoms flare up and become more bothersome. Researchers still do not know the exact cause of IC, but it is believed that there is a defect in the lining of the bladder in patients who have IC, and particles that come from the urine can leak into the lining and cause pain and inflammation. Women who have IC often can have their symptoms exacerbated by what they eat or drink, since different substances can pass through the bladder and cause pain. It is usually recommended to avoid foods and beverages that are acidic or spicy. Alcohol, caffeine, and carbonation can also trigger symptoms. It is important to work with a healthcare provider who can give you a list of foods to avoid and find out what might be triggering bladder symptoms or IC flares.